Welcome to Heart Healthy Living with Dr. Jackie, a Big Blend radio podcast that features Dr. Jacqueline Eubany, a board-certified cardiologist and electrophysiologist and author of the best-selling book, Women and Heart Disease, The Real Story. All right, so July 24th is International Self-Care Day, and this was started by the International Self-Care Foundation back in 2011. And we got to think how things, they really amped it up after COVID and realized, people need to take that time and really look at self-care. And that is something we're doing as a special edition or a special episode here with Dr. Jackie Eubany. Dr. Jackie is on Big Blend Radio with Heart Healthy Living podcast. We did an archived episode, and now we're doing the special one because self-care is super important, something we basically talk about every show. Today, we're going to get into the nitty-gritty, especially for those who are parents, busy parents, and caregivers, because we all know it's so easy to just grab that piece of pizza when you're just so exhausted. And what are you doing to yourself at the end of the day? Are you going to need a caregiver because you're caregiving? So we got to think about that. And so we're going to touch on that as a main focus, but we will cover self-care in general and how important that is to heart health, because from what I have been reading from Dr. Jackie and her book, Women and Heart Disease, The Real Story, that heart disease remains the number one killer of women in the United States, killing more women than breast and lung cancer combined. It's also the top killer of men. So very important to change our lifestyles around as best we can to really, I don't want it. I don't want the heart disease, Dr. Jackie.
Well, neither do I.
I don't want it. I know, as I'm reading this, and you've been on the show for so many years, and I'm like, even still, every time I read that statistic, I'm like, no, I don't want it. So self-care sounds good. It makes me feel like I get to go and have a bubble bath, and that's not a bad thing.
That is not a bad thing. That is not a bad. That's an absolutely a very relaxing thing to do. I like that idea.
Well, you're a doctor, and you're a nonstop. I mean, even getting you on shows, I'm like, okay. I'm always go like, okay, Dr. Jackie, we can always do it the next day. It's all good, and I think of nurses and all the staff in medical facilities, because you're dealing with patients who are, when you're not feeling well, you're not, the happiest people, and then you go home and maybe you have someone you're taking care of, so I think you guys are all, guys and gals, are all caregivers, right? So. What would you say is the first thing to do to add self-care in there? Because when we talk about stress is, again, the biggest thing out of this, right?
Yeah. No, I think it's definitely important to prioritize your physical, wellness, your mental and your emotional health. Because if you're not healthy, you're not going to be able to take care of, the loved one that you are taking care of. We recognize that it's a full-time job around the clock, but if you're not healthy, you're not going to be able to take care of your loved one. So it's very important that you at least set some time out to prioritize your physical, mental, and emotional well-being.
Yeah, I have a thing where in the mornings, and I do some very weird hours, even because of our travels, and, it's just crazy. So we don't have a normal clock.
Right.
And so that's not necessarily good, as I've heard. That's not good. However, I do have some things that I don't care what it is. Unless it's an emergency, my 5 minutes when I open my eyes is my 5 minutes. And I don't care what I do, but it's my time. And that's that. It's my 5 minutes. I have my 5 minutes of, this is your time before you start the day, to contemplate, to calm, to just maybe have a cup of coffee, whatever it is. But my 5 minutes is my 5 minutes. Is that okay?
Yes, I like that idea. I like that idea. And if you can just, it's kind of like a meditative kind of thing where you're just sitting there, just contemplating and just taking deep breaths and relaxing and just getting into a very calm energy. No, that definitely helps. I do
that at night too when I go to sleep.
You flush your brain or your mind, flush all the thoughts out of your mind so that you can have a restful sleep. I like that idea.
Now, what about sleep? Because caregivers, parents, this is why we have babies real young, right? Because there's no sleep and you're walking zombies with vomit on your shoulder and, all that. It's like, and then people are arguing and who's going to change the baby. And it's just like, just let it go. So I get it. And I always look at parents, I'm like, you did it, man. I power to you. But there's some caregiving comes in so many forms. Some people are permanent caregivers with a child that may be born into, hey, this is going to be a full-time gig, depending on their health. There's just so many circumstances with that, and it can be full-time. And sleep sometimes is a very difficult thing. Can we touch on the importance of sleep and heart health?
No, yeah, sleep is very important for not just for heart health, for your health in general. If you're not getting enough sleep, you're less likely to maintain we always talk about a healthy lifestyle. It's really hard to try to maintain a healthy lifestyle when you're so tired and cranky. For instance, if you're making healthy choices when it comes to eating, when you're so tired, you tend to grab for the not so great things like the sugars to keep you up and awake. And you're less cognizant of trying to eat healthy and picking healthier eating habits. And you're probably less likely to do anything related to your personal health. You're less likely to do because you're so tired. So sleep is actually very important for that.
Yeah, I like it. I talk to him. You know what? When something's really bugging you, it can keep you up at night. But then I've now gotten to this habit of telling my brain, I know you can deal with it, so deal with it. I'm going to bed. I'll deal with you in the morning and we'll sort it out. But I know that when I wake up, you're going to have the answer. And a lot of times it's true. It does work. Isn't that weird? Control your brain, y'all.
Yes. Your brain has a mind of its own, I always say. It always wants to talk so much and keep you stressed out, and you just have to shut it down.
And you go over there, you do your thing and leave me alone.
Yes.
And don't be so negative either.
Don't be so negative.
Well, I think what's so cool about this International Self-Care Day is, I was reading on their website of this foundation and they're talking about, and it's overseas, and they were talking about the predicament of healthcare. And I think the world is, this country, we're like, what's going on? And we don't know what's going on in the healthcare world now. And it's changing. And from what I can tell is they are focusing on the fact is one thing we can do is take care of ourselves. That is the guarantee. Like if you really, nothing's 100%, right? But if we take charge and practice self-care, which they're saying it goes beyond the bubble bath and the walk in the park with your friends. They're like, you need to actually start to learn about health. You need to learn the healthcare system. You need to practice self-care by learning like what we're doing, like the term of the month that you always do. Do you know what my term is? Can I tell you mine before yours?
What is your term?
Because it's self-care. Mine is it's no.
That's a good one. That's a good one. Yeah, that is a good one.
It's a whole sentence, and it really is. But you are allowed to turn things down and postpone or move things around or take that breather.
Yes, you don't have to do everything that everybody wants you to do. You don't have to be what everybody wants you to be. You can say no. It's okay to say no.
And speaking of that, like if you're breaking up with someone, you just go, I'm so sorry, I can't be all you want me to be.
So yes, I really like the idea of the self-help, the self-help day. We said International Self-Care Day.
Self-care.
Yeah,
and self-help is. It is. Yeah. It's about getting armed and ready because we don't know what's going to happen with our healthcare system ever. No, I'm not trying to freak people out, but the one thing we can do is take care of ourselves.
Yeah, and I also urge that people remember about their physical health and also try to remember to do the annual screening things that are necessary to keep you healthy. Like as women, if you do qualify for an annual mammogram, this is a time to start thinking that you need to make your annual appointment for that. If you need a screening colonoscopy, then you should start thinking about all the screening things that you need to do annually, and you should start making your appointments for those things.
You did hear me go, right? Well, but it's getting easier for patients, though, right? These
Yeah.
things are the healthcare system on the medical front, and what technology is doing is actually really amazing. And it's going to get better for patients as AI helps with all the paperwork stuff that drives everybody nuts. And so we don't want to go in the nut zone. We want to be calm and chill. And so I think things in the next 5 to 10 years are going to get better for that. But the other side, I don't know, man.
Yeah. It's hard to
You know,
say. It's going to be different. I don't know.
yes,
I
that's the
hope
word.
it's going to be different. Hopefully, we hope it'll be better, but we'll see.
Well, do you as a doctor have to like keep up with all of that? Like, does what you do as procedures, is that always changing now because of AI? And I mean, you got to put the word no out there too, right?
Well, they're always coming up with new technologies that are actually better and, safer, more effective and those kinds of things. So that's good. But we've always had AI in the periphery helping with certain things like, being the first read for EKGs, being the first read for imaging studies, but we end up overreading them, going back and rereading them and signing it. But they tell me that this agentic AI is coming and it's going to be able to replace us physicians. So we'll see. Let's see just how intelligent these things are. And
A long way.
they say it's a lot closer than we think. So I don't know. They say it's a lot closer than we think, but it'll be interesting to see. But I know that in a few years, the world is going to be very different. But yeah, we'll see.
I think that's it, man. It's weird. Yeah, some parts of it, but I think you're always going to need the doctors to be there, the surgeons to be there to overlook everything.
Yeah.
I mean, I've put things into Chat GTP, and sometimes I'm like, dude, I just told you that, and you just went this way. You're no, this is not happening. You have to read it. You can't just say
Exactly.
them.
Taking this word. Yeah, exactly. I mean, they need to be trained somehow, at least initially. We'll have human oversight, but we'll see how it goes from there. But it will be interesting. It will definitely be interesting. I
Well,
like how we segue to AI from self-care.
I know. Well, no, I'm going right back. I've got to segue back home. So my segue back is AI helping with things like, all these monitors we can wear for heart and things like
Yeah.
that. So you are actually like, I see so many things like keeping track of how many steps you're doing, your walking habits, your body, your temperature, your heartbeat, all of that stuff. And so if you have these kind of monitors, doesn't that help us? And like even what you're eating. I mean, I see nutritionists do that kind of stuff where they're looking at their food, and it's basically you can really keep track of what you're doing.
Yeah, it's actually making us more conscious of these things, and it should help people start making better choices when they can actually see some objective data that they can measure, and they have some kind of outcome to equate these data with, and to help people. I think it will help people make better choices.
Well, and that's the other thing. Okay, so I'm going to go back to AI in a second here for a reason, because it's about self-care, which means you start to learn. So the interesting thing is like when you would go to the doctor and you say, okay, your heart, you've got high cholesterol. A patient comes to you and says, okay, and you're going high cholesterol, you need to change your diet, start walking, do the 150-minute walk, as you always talk about on the shows. Go back to 5 ounces of wine, maybe once a day. That kind of thing. Here's some simple things which we talk about. But, you used to get pamphlets at the doctors. And now we have Google. Now we have AI. And so there's an interesting thing of people self-medicating on the internet. And I wonder about that with AI because it is really scraping everything. You could give yourself a disease, just looking at half of the stuff. I mean, you can make yourself think you have some horrendous thing and you don't. Or you can also go, okay, this is what the doctor says. Let me really look up the name, what this means, make your notes, list your questions. And is that part of the self-care is actually really understanding what your body is going through and doing your homework so you can have kind of a factual because I think it's scary when suddenly you have heart disease or diabetes and the diabetes can lead to heart disease. So you have to get past that emotional side and get into the fact zone, and then you can really start to tackle it, right? So does it help to have patients do that and start to really dig into the research of what's going on with their body?
Yeah. I mean, it is helpful when patients are, understand or have some understanding of their medical illness so they can have questions to ask. And, the conversation goes a lot quicker and a lot, smoother when they come in with some basic knowledge of, their medical condition. But not too much where you're Googling stuff and you're getting all kinds of lies, but at least having some basic information or some basic information is helpful.
Yeah,
And
because you don't want, because that's what I was saying at the other side. You start freaking out, like, I've got this, my foot's gonna fall off,
yeah, not to
And
that extreme, but yeah.
yeah, okay. So self-care is start to take actual prevention steps, right? So that's part of self-care, and scheduling time out, saying no once in a while. We've done so many shows where moms, I remember one lady on a show, it was an organizer, Regina Leeds, that's right, the Zen organizer, and she taught mothers to, even if they didn't have much space, she taught them how to create a little Zen meditation room in their walk-in closet. That is like when mommy closes the door, this is mommy's time, and because she said you really need it. Otherwise, things don't make sense anymore.
Absolutely.
So yeah.
Even the simplest of things like sitting in your closet or like you said, your first 5 minutes in the morning. So it doesn't have to be anything elaborate. People always want to think that self-care means you're going to go to the spa and spend hundreds and hundreds of dollars. And no, it doesn't have to be all that. It can be just as simple as 5 minutes of alone time, 5 minutes of just meditating and just clearing your mind. Yeah, even as simple as that will work for self-care.
You know what I think too is that we are multitasking all the time, that I've started to realize how bad I am at that. And because I'm not doing as well if you're multitasking. So to just focus on what I'm doing. I know that sounds like obviously we do in work and stuff, but like if you're cooking a meal, cook the meal. Don't pick up your phone. Don't, you know what I mean? You can play music or whatever, but don't pick up your phone and start talking to someone while you're cooking and then take a phone call on top of that. And your food is dead then.
Right. Yes, I like that. Being mindful when you do things, being present in the moment while you're doing it. You enjoy life
So
better
stress
and it's better.
can eventually physically hurt us in heart. I mean, that's what I always think. At the end of the day, we all die of a heart attack, right? No matter how we go.
We die of some form of heart disease. Yes.
So we're basically trying to de-stress our heart at all times, like not let it get stressed out. Let it be happy and effective and be a well-oiled machine, like our engine of our car.
Yes.
So we really are like we should be looking at combating stress all the time.
Yeah.
Really, that's kind of how I look at it. What do you think?
Yes.
You're the doctor.
I think managing stress and self-care helps you take care of yourself better because, of course, stress can lead to some medical conditions, or if you are predisposed to, heart disease or something, stress can trigger an episode that may land you in the hospital. I think, self-care, trying to live a stress-free life and being cognizant of your physical health, emotional and mental health, well-being, it goes a long way in helping you prevent illness and helping you live a longer, healthier life.
And I think travel makes us younger, so we should do it.
Yes, absolutely.
I think it's part of self-care.
Yes,
Yeah.
I would agree with that. I agree. As a person who travels all the time, that's the way I distress. I like, being in environments that are different from my typical day-to-day life, learning new cultures, trying new cuisines, exploring, different places that I've never been before. That relaxes me and that makes me feel good.
Yeah, because you're in that moment. You're in the zone.
Yeah.
I realized that that's way back when I used to smoke cigarettes. Sorry, Dr. Jackie, but it was
Oh, good heavens. You didn't smoke, did you?
years and teenage years. And then I quit. And then in the early 20s, because I was in a band and all that. And then I got rid of it because I really can't. I haven't smoked in, my gosh, over 20, 30 years.
Wonderful.
Or so. No. It was just stupid. I'm allowed to call myself stupid on that. But you know what it was? It was me calming everything down. It was about just a zone. When I was doing music, when you're on stage, you're in a zone. If you're looking at your phone or something else, you're not performing. And so when you're in that zone, Like I imagine that in surgery and things like that, when you're helping a patient, there's nothing else other than exactly what you are doing in that present moment. And that's the same thing in travel. When meeting someone at maybe a street cart or something, you're in that present moment when you're traveling. And I think that's what part of it is that you're actually living. And I don't know, when we clutter everything, I wonder about the stress of cluttering everything, because you're making everything tax out. It's like all systems go all the time. And that's what we've been doing to our bodies for the last 100 years, is all systems go. As we grow technology, we're supposed to be making it easier on ourselves, not harder. So there's that balance.
Right. It should be getting easier, but yeah, overall.
All right. So what is your term of the month?
My term of the month is plaque.
Ew.
And plaque, as we've discussed it in many ways, but plaque is the fatty deposits that occur in the walls of your arteries. And depending on what organ system that artery supplies, that organ doesn't get enough oxygen because the plaque obstructs the blood flow to that organ system. So overall, if you have plaques in your arteries of your heart or your brain, it can lead to a heart attack, it can lead to a stroke. So yes, so plaque.
Is it like hard fat? Like hard fat, like you see in,
yes.
Like if you open up like you're going to cut a steak open and you see that big, thick, white fat?
That's just fat. But plaque is just a combination of fat and cholesterol. It forms a hardened plaque. So it's hard. So it's not just soft, but yeah, that's just pure
so like
fat.
what, plaque on your teeth, like tartar.
Yes, exactly, like tartar on your teeth, exactly. So it forms in the arteries of your heart and prevents the blood from flowing in through the heart. Yeah. So it's kind of like it's kind of like a clogged pipe. You know how you have a clogged pipe and you try to turn on the faucet and the water is not draining as quickly as it should until you pour the Drano that clears it out. So it's a very similar kind of thing. The plaques form along the artery, so you can't get blood flowing through the arteries as smoothly as it normally does.
So I know that that's on the this is weird, the upper part of our body, right? Because we're looking at the heart and everything. But like is that when we eat like antioxidants and things like that create more, like fiber food creates more air so that there's more of a, like you get stuff out of there, man, because we can't brush our arteries.
No, you can't. So you have to eat healthy. So all that plaque comes from foods that you eat, fatty foods, high cholesterol foods. So you want to cut back on your cholesterol in your diet, doing things like physical exercise, eating healthy, everything that we talk about, in terms of prevention of cardiovascular disease also helps prevent plaque formation.
Okay, so now what happens if you've created a bunch of plaque over the years? Can you take your plaque out, or you're just like, all right, you've done a bunch of damage, you need to stop immediately, but that plaque is staying there, it's not going. So you've got like a little bit of leeway in there, so you better behave 100%. Is that where we're at? Or can we reverse the plaque through good actions? Or is it too late once we've created that plaque?
No, it can be reversed with healthy lifestyle, with medications. So yeah, with healthy lifestyle, you can.
Remove the plaque.
If you eat healthy, it can get resorbed with physical activity, with healthy eating, and of course medications can do it as well.
Well, how about that for self-care? I'm going to be a plaque destroyer. Kill the plaque. It's a video game that we want to make it reality. Yeah, way, how interesting. It's just always, I want to have that visual, like then you can understand it.
Yeah. With physical, like the actual term is we stabilize the plaque so that it doesn't rupture. So you run into trouble when the plaque gets, bigger and it's soft and it ruptures and then it goes straight into, it goes more distally into smaller blood vessels and prevents blood from getting to organs, and the tissue ends up dying, and then you have problems. Like if it happens in the heart, you end up with a heart attack. If it happens in your brain, you end up with a stroke. So improving your lifestyle will stabilize the plaques and prevent them or preventing them from rupturing and causing trouble down the line.
Wow. Okay. I'm going to be very good to my arteries. I'm going to talk to them every day and say, listen, we're going to bust the plaque. We're going to bust a move and get out there and bust the plaque. Okay. So Dr. Jackie, before you go, what in the hospital world or the health world, right? In whether it's a clinic or, an office, what do doctors and nurses, how do you all get, because you do so many hours and things like that, how do you take care of yourselves as caregivers? Like, what are some of the things that you've seen and what do you do that gives you like a little respite? Because that's what when we're going back to all the people that care for people and, next thing you know, they're walking zombies and, then, and that does lead to bad habits, which can also lead to really bad things. It can lead to dysfunction in a family is where I'm going, to be very honest, through things like that. So, little bits of self-care can go a long way of just keeping sanity, and I'm not being weird about my words. I'm being real. When people are exhausted, they lash out quicker than they would, if they had some sleep. So that's, the basis.
Well, how do I personally do it?
Yeah. Or what have you seen in the hospital field or with what you do? You do what you do. Yeah. Tell us.
Yeah. What I do is I try to maintain an exercise routine, and that helps me stay relaxed. So I like spin class. So I actually go to spin class 3 days a week. So that helps. Like I said, I like traveling, which is, I don't do it often, but that definitely helps with my self-care. And I meditate in the mornings. Not every morning, but on the mornings that I do have some time, I would sit there and I'd meditate. Those little things help me with my self-care.
It really goes with what you like as an individual, right? I mean, I used to just turn on really loud music and dance around to wake up, and I would be in the best mood. I was ready to rock the world. And, so I think it's each individual in a way, huh?
Yeah.
You find out what it's about finding what makes you happy.
Exactly. You have to find out what makes you relax and calm and de-stressed, and then you try to do that as often as you can.
Very cool, Dr. Jackie. As always, thank you so much. Everyone, Women and Heart Disease, The Real Story is a bestseller. Go get it on Amazon, all those great places. You can also go to womenandheartdiseasebook.com. Dr. Jackie will be back next month in August for the second Wednesday, not the third, the second. And everybody, happy International Self-Care Day. Let's all go for a walk. I just feel like we should have a mass walk around the world. All right. Thanks so much.
Thank you. Have a good day.
You too.
Bye.
Thanks for joining us on Big Blend Radio's Heart Healthy Living Show with Dr. Jackie. New episodes air every second Wednesday at 12 p.m. Pacific Standard Time. You can keep up with Dr. Jackie at womenandheartdiseasebook.com. Listen to the shows at bigblendradio.com.